And welcome back to Focal Point, AFR Talk. Brian Fisher is my name. The program is Focal Point. The network is AFR Talk, the most dangerous and feared radio network in all of America. Went on the SPLC's website yesterday, by the way, looked at their hate map. You can Google that, SPLC hate map. Boom, up pops their hate map. All the groups that they think hate people, and we're on that map. Remember, that's how the shooter at FRC, that's where he developed his hit list. Just went to SPLC. I got to find out all the people that hate people, and I'm going to go wipe them out. I'm not interested in talking to them. I'm not interested in debating them. I'm not interested in dialoguing with them about whether homosexuality is healthy behavior, whether it's normal, whether it's acceptable, whether there are health risks. I'm not interested in talking about whether homosexual marriage, homosexual parenting is good for kids or bad for kids. I have no interest in any kind of dialogue here, any kind of debate. I'm just going to take a gun in there, and I'm going to shoot as many people to death as I can. And I'm going to take Chick-fil-A sandwiches, and I'm going to smear them all over their faces. That's what I'm going to do. Now, I'm not saying everybody on the left wants to do that, or even most of them, or even many of them. But here's one that certainly did. He was a homosexual activist. He worked in some kind of a gay and lesbian activist center there in Washington, D.C. So how did he pick his target? Let SPLC pick his targets for him, and he picked FRC. If he'd lived in Mississippi, probably would have targeted the AFA. Now, Dr. Carson wasn't through. Now, we've got this monstrous Obamacare thing. I mean, this thing is a monstrosity, ladies and gentlemen. It's a monstrosity. CBO is out there reporting now that the projections of the cost of the insurance subsidies have already gone up 29%. This thing hasn't even gone into effect yet. And the CBO says the subsidies are going to cost taxpayers 29% more than we projected back in 2010. Remember the whole deal back then, this is less than $1 trillion. We can afford this. We can handle it. Now they're saying we were off by $233 billion with a B dollars. And the CBO is also estimating in this latest report that 7 million workers are going to lose their employer-sponsored health insurance. That's fine with Obama and the fascist in his administration, because that's going to drive everybody to single payer. It's going to drive everybody to the government program. All of the insurance companies are going to be out of business because employers are going to say, look, I can save a whole lot of money by just paying the fine. I'm going to drop employee insurance, let them fend for themselves. Where are they going to go? They're going to go to the government for their health insurance. But the number of people who are going to lose their insurance now, that is twice as many as the CBO had previously estimated. And now they are expecting that the monetary penalties are going to be $36 billion higher from 2014 to 2019 than they thought. So you and I are going to be penalized $36 billion more than they figured. Now, you would think this would be major news, wouldn't you? That's what you'd think. I got a piece here from Newsbusters, sent a tweet out with a link to this story. NBC and ABC on Tuesday and Wednesday night did not cover it at all. So CBO is saying, hey, we were off by 29%. We haven't even started. This thing hadn't even rolled out yet. And we're off, already realizing we're off by 29%. That's just going to get worse when this thing actually gets unbundled and is put into action. And we were way off on how many people are going to lose insurance. It's going to be 7 million people are going to lose their health insurance under this deal. Here's what the NBC Nightly News covered on Tuesday and Wednesday. They had a big story on Chris Christie's weight. They had a story on the new Monopoly game piece. They had a story on the 2014 Winter Olympics. And, of course, they had a story on the Boy Scouts. ABC World News, they didn't touch the CBO report at all, nothing. They had a piece on Chris Christie's weight. They had a piece on the new Monopoly piece, which is a cat. They had a story on the Boy Scouts. And they had a nice spread on Barbara Walters recovering from the chicken pox. And a story about the nation's youngest billionaire, not a peep about the cost of Obamacare. And now we discover, we'll go to the phones after this. Well, I got to play the Carson sound at the end of the phones. But now I've got this story here indicating that the CBO, the Government Accountability Office, another government agency, is predicting that 460,000, almost 500,000 kids are going to lose their coverage because of Obamacare, because of the formula that Obamacare is using to decide who is eligible for subsidies. I won't go into the details here. It gets kind of convoluted, but it has to do with how much the employee, what it costs him for his insurance policy. If it's just him, not his family, and if he can afford the insurance that his employer is offering below the threshold, then he is not qualified for any subsidies, and his children do not qualify for any subsidies, which means that about 7% of uninsured children, 460,000, are going to stay that way. So here's 500,000 children are not going to get health insurance because of Obamacare. Ladies and gentlemen, this thing is a catastrophe. It is a monstrosity. It is a colossal, stupendous failure of historic proportions, and yet Obama blunders on. Now, here is the solution that Dr. Benjamin Carson had to health care, and this is it. In less than 60 seconds, he gave us the solution to health care reform. Let's listen.
Here's my solution. When the person is born, give them a birth certificate, an electronic medical record, and a health savings account, to which money can be contributed pre-tax from the time you're born to the time you die. When you die, you can pass it on to your family members so that when you're 85 years old and you got 6 diseases, you're not trying to spend up everything. You're happy to pass it on, and there's nobody talking about death panels. That's number one. And also, for the people who are indigent, who don't have any money, we can make contributions to their HSA each month because we already have this huge pot of money. Instead of sending it to some bureaucracy, let's put it in their HSAs. Now they have some control over their own health care.
So that's Dr. Benjamin Carson. Very simple. This is a solution I've talked about from day one. 2 things is the solution to health care. All you got to do is these 2 things. That's it. You can reform health care instantly, immediately, instantaneously. You don't need 2,700 pages of legislation to do it. You allow people to have health savings accounts. It's their money. It's in their name. It's their money. If they don't spend it on health care, they get to keep it. You have a lot of these flexible spending accounts, and they're nice, but at the end of the year, if you haven't spent it, you lose it. So you got to find some way to fork it over to a medical practitioner, whether you need the health care or not, or that money's gone. You never see it again. But an HSA, that's your money. It's got your name on it. If you don't need it, you take care of yourself, you floss, you exercise, you eat right, you don't need to go to the doctor, then all that money you get to keep, and it accumulates. And then you couple that with a low premium, high deductible insurance policy, catastrophic. I mean, it's there for emergencies, medical emergencies, big high dollar cost things. That's what I had when I was headed up a pro-family organization in Idaho. We had a $7,500 deductible. So anything Debbie and I spent was out of pocket up to $7,500. But the premiums were low enough that the organization was able to put the differential into a health savings account for Debbie and I in our name, our money. We never needed it. We didn't. Well, I think I had 1 crown done, paid cash out of my health savings account to take care of that. And then when I had the accident here, that was a pretty major event, the hip surgery. I had money in my health savings account to cover our deductible. It was covered. I had enough money right there to do it because we'd taken care of ourselves, and the account had accumulated. There was money there to meet the deductible. There was money there for routine health care expenses, and we just didn't use it because we got to keep what we didn't use. Now, right there, what Ben Carson is talking about, that's it. Those are the only 2 things you need to do. Health savings accounts coupled with catastrophic insurance, that's all you'd need to do. Those 2 things, you could put that on 1 page. That's a one-page piece of legislation. And health care would be reformed. Consumers would be back in charge of the cost of health care because you're paying for it out of your own pocket. So you got to decide whether you really need to go to the doctor or not, whether you want to get the brand name or whether you're willing to settle for the generic prescription because it's out of pocket. So it's going to bring the cost of insurance down. It's going to bring the consumption of healthcare services down because you're paying for it out of your own pocket, and you're still protected. You got a major event. You are sheltered. In fact, I think our plan over $7,500, it was like 20% up to $10,000 we had to pay, and then it was 100%. The insurance company covered 100% after that. Well, let's go to the phones, and that's Carson right in front of Barack Obama, the architect of this massive fascist Mussolini care takeover of 1/6 of the American economy. And he says this is way too complicated. Here is a very simple procedure that would take care of all of the problems. Let's go to Ray, Tampa, Florida. Ray, you're on Focal Point with Brian Fisher. What's on your mind?
Hey, Brian. How you doing?
I'm doing great. How are you?
I'm blessed, man. Hey, listen, I got a couple things I just want to briefly touch on. First of all, the name of what Barak means in the Hebrew.
Yeah.
I was looking that up the other day. I was curious because I forgot that name is in the Bible. It's a biblical name.
Yeah, it is.
And it's in the book of Judges.
Uh-huh.
And I looked up the name, and it means lightning.
Yeah, lightning.
Now, what does that refer to? When Jesus saw Satan fall as lightning, remember?
Yeah, so I'm falling like lightning.
Now, I know there's a Pastor Jeffress who's a Baptist preacher, and he's been talking about Barack Obama, and they say, some say he's the Antichrist, and he says he doesn't believe that. But we can see what's happening in our world today through this leader.
Yeah. Well, and Dr. Jeffress, by the way, has a program on this network. You can hear him early in the morning right here on the AFR Talk Network. And, I prefer to look at it, Jay or Ray, at what John said. There is an Antichrist that is coming, the Antichrist, capital A. But even now, he says, many Antichrists have gone out into the world. And very clearly, Barack Obama is one of those. He is an Antichrist. He's a little a Antichrist. I'm not saying he's the big A Antichrist, and Dr. Jeffress is not saying that he is the big A Antichrist. But John makes it very clear that anybody that comes out and offers a substitute for Jesus Christ, that's what the word anti means.
Right.
In Greek, it means instead of. Okay. So anybody comes out and offers an alternative to Jesus Christ or is against the work of Christ, he is an Antichrist. I'm looking for that passage where he says of the number of Antichrists that have gone out into the world, and I do not know where that is. Oh, yeah, here we go. He says, children, it is the last hour, and as you have heard that Antichrist is coming, so now many Antichrists have come. And Barack Obama is clearly an Antichrist in the small a sense because he is against what Christ is for. We know that because Christ is for the sanctity of life. Christ is for the sanctity of marriage. Barack Obama is against the things that Christ is for. That makes him an Antichrist. Focal Point, AFR Talk.